So, does anyone here have a friend or a family member with high blood pressure? Okay. After you leave here today, you'll be able to go tell that friend or family member that LaToya taught you how to take an accurate blood pressure. What we're going to do today is a demonstration on taking blood pressure. Here's some handouts. It'll walk you through what I'm going to be doing today and everything I need to complete the demonstration. But first, I'm going to need a volunteer. Wanda, come have a seat. And I'm going to go ahead and discuss the tools I'll be using today. First, we're going to use a manual blood pressure cuff. Here's the cuff. There's a gauge on here that's going to give me the numbers I need for the reading. This is just some tubing that leads up to the pump. The pump has a valve on it. It's very important. Also, I'll use a stethoscope. The stethoscope has earpieces and there's ear tubing. The tubing that leads up to the chest piece. There's a bell and a diaphragm. And I also need paper for documentation. So let's get started. You want to make sure your patient is relaxed. After you make sure your patient is relaxed, you're going to lift her arm right at the level of the heart. Then you remove any clothes that obstruct the blood pressure cuff. You place the cuff on the patient. There's an arrow here. It says artery. You're going to place that right up on the brachial artery. You want to make sure the cuff is tight enough so that it doesn't, if it's not tight enough, it'll bruise the patient once pumped. Then you put on your stethoscope. You want to make sure the ears of the stethoscope is facing frontward. You take the diaphragm, you place it right over the brachial artery. How you notice the brachial artery, if you feel for a pulse, it'll be pulsing. So you place that there. You make sure that you're hearing the sounds of a pulse. And then you start to pump. Once you start pumping, you're going to pump to about 160, 180. Once you've gotten to that, you'll take the valve, you'll loosen it slowly. Listen for a sound similar to a tap. Once you hear that first tap, that is just systolic pressure. Then you'll continue to listen. When those taps stop, that's your diastolic pressure. It was 140 over 86. Okay. So we're going to go ahead and document the blood pressure reading. Her blood pressure reading was 140 over 86. A normal blood pressure reading should range about 120 over 40. It should be 120 over 80. If it's higher than that or maybe a little bit lower than that, what you're going to do is contact your physician and get with your physician and see what's normal for your weight and your age. It doesn't necessarily mean that you have a pre-hypertension or hypertension. It just means that you might be a little bit different than what the statistics are. But that's how you do manual blood pressure, and that's really all I have for you today. Thank you.